and he's a very strong advocate for developing the specialty of family medicine in our country. It's my proud privilege, Dr. Beleaguered Sir, please. He'll be delivering talk on family medicine that key to India's Beleaguered health system. Please.
We have lectures on family medicine at all. Is it not a lip service by the health planners and other conference organizers that we always say that it should be developed, but no one tries to develop it? Do not we know that in any delimited territory, in any city of India, including capital city of Delhi, we have at one time 70% people who are engaged in the practice of family practice. All the specialists and super specialists always agree that family physicians can be their best resource persons or referrers. But down the line, we miss on one thing: who is looking after and who is caring for family practice at all? In the post-independence India, when we had very few qualified allopathic graduates, and it was ruled all by quacks and quacks only, who were interopathy ones or otherwise. And today India has made huge strides. Now we have specialists and super specialists of the best people on earth, and we have state-of-the-art medical facilities. But what we have lacked in is to develop a system. In the pre-presentation, some speaker did speak about that even in the developed West, it is the general practitioner or a family physician who is at the bottom of the pyramid, center of all health planning, but in India, it is free for all. We have the richest of the rich people here, we have poorest people here, but what is happening is total free for all. Anybody can go to anybody. There is no system. There is a huge wastage of medical resource. Do not we know that many of the super specialists are handling very small cases? They are not getting those challenging cases. If in a team, if there is a teamwork, a cardiologist will say, sorry, I will not deal with this case, I will deal only with that part, and other should be taken care by a family physician. So over a period of years, we have failed to develop a system. When I speak about or advocate the cause of family medicine, my aim is not at all to oppose anyone, but my definite aim is to develop a system where we are able to utilize our rather scant medical services in a more economical, optimum manner. That our aim is. Some time back, there was a huge attendance of younger crowd here who are always, due to what one or the other reason, specialization obsessed, and they are not wrong. They do what they see. A family physician has never been glamorized, and specialties are always done so. Aim is not to oppose anyone, but to develop a system. I have a small presentation in which I will be telling about the status of family practice. I will be speaking about the problems the family physicians are facing these days. I will be speaking on the medical situation in India and how best we can utilize the available resources for the better medical care of our India. As we all know, family medicine is a medical specialty that integrates biological, clinical, and behavioral sciences. The scope of family medicine includes all ages, both sexes, all organ systems, and every disease entity. It involves personal health care from first contact care to ongoing care of chronic diseases, integrating preventive, promotive, and curative services, thereby encompassing the whole spectrum of medical intervention possibilities. This is the best thing is a family medicine is a horizontal specialty, thereby it gives you a huge satisfaction. It can touch any specialty. You can know some part of everything, and that is the whole beauty of family medicine.
Hello, sir.
A family physician is a multi-competent specialist. I not only call him a multi-competent specialist, I consider him a mini multi-specialist who not only provides the first contact care, but also the continuum of care in patient-centered setting to protect, maintain, or restore our health on an ongoing basis. I know I myself have been in practice for last 30 long years, and Delhi required is their upgradation, their updating, and they are incorporating into a system which will do the service to Delhi people much more. Who does not know India is developing on one side of spectrum into a medical tourism destination with state-of-the-art facilities, and on the other side of spectrum is India is to host to practically every possible disease, carrying maximum disease burden of cardiovascular, respiratory diseases, diabetes, anemia, mental, liver and kidney diseases, and myriads of infectious diseases. And also, who does not know India is the unfortunate host to all infectious diseases as well as the new emerging lifestyle and chronic diseases with practically little control on any. We are very proud of saying in our conferences that India will be the capital of diabetes, will be the capital of leprosy, will be the capital of tuberculosis, will be the capital of mental diseases. But that is not a very proud situation. This does not portend any good on the health front in near future to the people of India. The key parameters or determinants of health in the society, the Indian infant mortality rate, maternal mortality rate, expectancy of life still continue to be among the lowest in our Southeast Asia, practically rivaling the countries of sub-Saharan Africa. Is it not very shameful for us? With the best medical minds, that India is still around 150th in a tally of 187 in 2014. When we can boast of the best minds, when we can boast of the best skills, when we can boast of the state-of-the-art facilities, then where are we wrong? Why do we have to depend on governments? Why do we have to depend on planners? Why do we have to depend on someone else to do something for us? While sitting here, why can't each one of us decide that I'll decide our course, we will guide our destiny? Is not impossible. Some coordination, some system development is definitely required. Top causes of death, as we all know, ischemic heart disease, chronic obstructive pulmonary disease, diarrheal diseases, low respiratory diseases, tuberculosis, preterm birth complications, self-harm, road injuries, diabetes. What is, if we try to enumerate what are the reasons for our various problems? Shortage of doctors, nurses, paramedical staff, lack of infrastructure, bad service conditions, poor availability of drugs and equipment, lack of learning opportunities. I'll add to it, the biggest problem is our poor health lay, which is even governments have been changing, provinces have been changing, but it is woefully lower than 1% of GDP. Funding is not there. And second, which I see personally, ever since the advent of capitation fee medical colleges, the quality of medical education has gone drastically down. The products which are being churned out in thousands and thousands are perhaps not able to do their job that well, and that is what does not enthuse. So that means we have to make our system so competent that we enthuse confidence in people as well as health planners both. When I say I am still an advocate of family medicine, and we are the people of my age may have started family practice, but I see very few doctors joining family practice now. What are we losing? The age-old friendly neighborhood doctor. I personally believe in Delhi still we have a concept of neighborhood doctor. Every colony, every small territory has a family doctor. That is a huge loss to our whole understanding. That is why we have so many litigations against doctors, etc., etc. The corporate has, whether we want it or not, and we will not say we don't want it, the big money is required for funding in the private world. The corporate have practically invaded the whole health order. We definitely need the money, but the paradigm change which has come from a model of West cannot be extrapolated in a developing country like India. India is still a socialist country, and a vast majority is still depend on
government money, government dispensaries, and that is where the role lies of a rather more economical family physician who still makes his services available at much lower the cost. We used to read in our PSM classes in our final year that the tertiary care, primary, secondary and tertiary are the most effective and economical. What is happening now is huge funds of money are being diverted to total tertiary care. Again, repeating my words, I am not against it, but the primary care, the money spent on primary care is far more better utilized money than on any other. How to solve India's complex health delivery system? First, increase the budgetary health outlay. Strengthening primary healthcare apparatus along with safe water, sanitation, safe excreta disposal, health education are perhaps the most economical long-term measures within the realm of Indian scenario. Along with this, I see a lot of specialists and specialists not getting the right kind of cases. Optimum utilization of all spectra of healthcare personnel is most important. Most medical practitioners in Delhi, as I know, in practice for the last 35 long years, are grossly underworked. They do not get the right kind of cases, and that is also one cause. It is lower satisfaction also, and not proper care of patients also. Change in medical curriculum is one of the most important things we should bring about. In our graduation, there is no subject like family medicine at all. Anyone who thinks does not get a PG is forced to enter family practice. I think it is a gross mismanagement. We should have family practice, family medicine right at UG level. A paradigm change in medical education from specialty to community focus is essential to larger and widespread healthcare dissemination. Creation of departments of family medicine in all medical colleges should be a top priority. In last, I would say 2 decades, my personal efforts and organizational efforts through NGOs, writing letters to Government of India, to Secretary Health or Delhi Government or Delhi Secretary, has not yielded any results. Promises are made, but still they do not have this priority at all. As in India, we have the lowest priority for education and health, so are we also suffering in the same way. Family medicine as a distinct subject in undergrad curriculum is an absolute must. Post-graduate education in family medicine should be a viable option. I see lots of my friends doing, but they are not that enthused in this specialty conscious younger generation of medicos. We now have MD family medicine in few medical colleges all across India, and we also have DNB in family medicine and a diploma in family medicine also, but they are somehow, due to various reasons, they are not glamorized, they are not properly served, they are not properly projected, and most important, at UG impressionist mind, till the time at the undergraduate impressionist mind, something is hammered into the minds of young graduates that this is also a viable choice which makes you a better doctor, serves your country better. I am sure this will go a long way. One of the things I feel extremely strongly about is when I say we should develop a system whereby family physician is able to route all the cases to specialists and super specialists, we must root out quackery. It is a shame in the capital city of Delhi, we have the continued presence of nearly 30 to 40,000 quacks. No check by the governments, they are busy in their own vote banks. So it is left to us only to look after our territory. A dynamic and bilateral understanding between journalists and specialists can be a fulcrum to systematically eliminate quackery once for all. Another bad thing which is attached with medical profession, which all political leaders are very fond of,